Now we're all pretty accustomed to taking work Zooms from the kitchen, breaking out our laptops in the bedroom, even having home studios in our living rooms. So will we ever go back to our offices, or is work from home here to stay? NBC News correspondent Jacob Ward takes a look.
For a company like Slack, attractive offices were a perk of the job. Slack had more than 2,000 employees in 16 locations around the world before the coronavirus. But when we visited the San Francisco headquarters with their CEO in June, their offices were frozen in time.
So this is your first time back in the office in how long?
In 3 months.
3 months.
Yeah.
Is it weird to be here?
It is really weird. It's also weird to see it empty like this.
Totally empty. This is a lot of rent you're paying for an empty office.
This is a lot of rent, and also a lot of monitors and a lot of chairs and desks.
A lot of gear not being used here.
Yeah. What's strange is makes you wonder if we ever really needed it at all.
Of course, the product Slack sells makes this new world possible.
The technology is on the one hand facilitating something very positive, but is also creating a very difficult change for a huge swath of the country.
Yeah, and the knock-on effects, I mean, it's more than the local businesses, as important as those are. There's all the infrastructure that we've built up. You know, there's the tax base of the cities. When you have this much of a disruptive change or this dislocating of an event, everything changes.
Now the company, like so many others, is letting employees work remotely until at least 2021, and in some cases, forever. The question is, does it work? Kira Federer gained back 2 hours a day now that she no longer commutes to her job at website Reddit. The company has embraced the new reality.
It really made me feel unheard when you fell asleep during my meeting.
We now have a stipend to help us create a work from home space that is both ergonomic and comfortable. We've added a wall into our bedroom and created a separate workspace.
With schools also remote, parents whose jobs allow it are basically locked into working from home. So Reddit now offers flexible work hours. It's a huge help for working parents like Federer, who splits the workday with her husband.
The day starts at 6 a.m. when the baby wakes up, and the parent on duty for morning duty will have 6 a.m. to noon, and then the next shift is noon to 6. Whoever gets more of the nap really wins that particular day. Reddit's actually put on a day where we had an Elsa impersonator come and sing.
That is a perk I've never heard of.
Exactly. Someone has to have very much walked in a parent's shoes to think to do that for an entire workday.
Many companies are offering new benefits while employees work from home. But Richard Larimer, CEO of RLM Public Relations in Manhattan, says remote work is a productivity disaster.
I think eventually all these companies that are saying, yes, you know, we're going to do this forever, work from home forever, are going to take it back.
He says there's just no substitute for in-person collaboration in his line of work.
I don't feel like the people that work at this company are really connected. And unfortunately, there were a few people that worked for us before the pandemic who couldn't work from home and weren't able to sort of get it together on their own at their apartments or houses. And we had to let them go, which is sad because they were doing fine before the pandemic.
Before the pandemic, economists found that most people don't want to work from home forever.
It's only around a half of Americans that can work from home actually want to.
And it may be that while no one misses commuting, perhaps offices create loyalty.
If those new employees are working from home 5 days a week, it feels like a gig job. I mean, honestly, what connects you to your firms?
Even Federer, with a stipend and an office, is stretched thin.
How are you doing in figuring out how to pace yourself, how to set boundaries? Stumped you there.
You did. You did. I will have to think about that for a moment. I will tell you, how am I setting boundaries? The line between professional and personal was once very clean, and now it's all but gone.
Working from home may not work for everyone, but this grand national experiment seems to be teaching us that the old way wasn't working either.
I think if given the option, I would certainly want to return, but I don't want to return to 5 days in the office.
Larimer says his company will be back in the office with a few adjustments as soon as there's an effective vaccine.
I don't know if they'll come every day, but they'll come to when they need to get together and they need to actually work on projects that they have to sit next to each other, or 6 feet away, I should say, and get the work done.
Jake Ward, NBC News, San Francisco.
Movie theaters and concert venues are closed. Sporting events can't have live audiences. The coronavirus has really changed the way that we entertain ourselves. NBC News correspondent Carrie Sanders shows us how people are getting creative with their socially distant free time.
Allison, we know so many people have been following the rules, social distancing, not gathering in large crowds. But at the same time, folks at this point are getting pretty bored, cooped up in their houses. We know that streaming services like Netflix have seen an 11% increase in subscriptions. But overall, the kind of things that people like to do, go out to, say, concerts, well, that's been a huge drop, about a $9 billion loss in the last 5 or so months because of this pandemic. But there are some creative ideas that are beginning to take root. For instance, down on Biscayne Bay, a band on a boat. Others come on boats, on rafts, on surfboards, get in. They're socially distant, but at the same time, they're finding a way to get out. Movies. People love to go to the movies. Got the popcorn ready. So here's a couple options. AMC, which has been shut down 2 months ago, opened up in Europe, and now on August 20th, they're going to be opening in the United States. There's going to be a very different experience because there'll only be about 30% of the people allowed in, no full capacity. You'll have to wear a mask, so eating popcorn will be a little bit of a challenge, but they'll still be selling popcorn, allow you to pull the mask down for a moment. And then, of course, you have what's going on in Walmart parking lots, and that begins this weekend in some Walmarts, where they're going to convert the Walmart parking lots into pop-up drive-in theaters. So, as they say, see you at the movies.
President Trump pretty proud of his use of the Defense Production Act today, repeatedly calling the U.S. the king of ventilators.
I've used the DPA more comprehensively than any president in history. There was a time when the media would say, why aren't you using it? Why aren't you using it? Well, we have used it a lot. Where necessary, only where necessary. Our nation is now the king of ventilators. I say that, the king of ventilators. We're sending them all over the world and helping a lot of countries that could never have ventilators.
Infectious disease expert Dr. Umesh Adalja joins me now. He is also a senior scholar at the Johns Hopkins Center for Health Security. Dr. Adalja, there was a PPE and a ventilator shortage at the beginning of this pandemic. Do we have enough of the equipment that we need here in the U.S. to keep fighting this virus into the fall, winter, and potentially beyond?
It looks like we do have enough ventilators. I think we have solved the ventilator problem, and we're actually using ventilators less frequently in patients because we've gotten much better at understanding their oxygen needs. When it comes to personal protective equipment, I don't think we can ever have enough. I think we're going to be dealing with PPE shortages across the country in different places where there are hotspots throughout this pandemic. And you have to especially remember that when flu starts, flu is going to be competing not only for bed space with COVID-19, but also with personal protective equipment. So we want to make sure that through the fall, that hospitals have enough supply on hand of gowns, gloves, and masks, and that we can continue to treat these patients safely.
A new study found that the coronavirus can be deadly even for younger healthcare workers. In this Kaiser Health and Guardian study of 167 frontline workers who died, 21 were under 40, 8 were under 30. What do we need to do to make sure that all healthcare workers of all ages are safe?
The biggest way to protect healthcare workers is to make sure that they have enough personal protective equipment, that they're using it properly, that they're trained to use it, and that they don't have to kind of skimp on it or try and reuse personal protective equipment that might be outdated or worn. So that's the key issue. Healthcare workers are exposed to higher amounts of the virus on a continual basis, and that is why you're seeing them get infected at the rates that they do. And because they get infected by patients doing direct patient care, they can often get infected with a high amount of the virus, a high inoculum, we call it, and that can lead to more severe illness, even in younger individuals. So this has to be key. Healthcare workers have to be protected. They're the first line and front line for defeating this virus.
Dr. Adalja, another study says the coronavirus is at least as deadly as the 1918 flu pandemic. What else did that study tell us?
Well, that study showed that 1918 and the COVID pandemic in New York City during the peak months were of comparable severity. It's actually 1918 was a little bit more severe than COVID-19, which is remarkable because you have to think about the fact that with COVID-19, it reached almost to 1918 with modern critical care, with antibiotics, with ICUs, with critical care. So this tells you that this was a real hit that New York City took that was on the level of the 1918 type of an event. So it's not something that we can minimize, and it really gives you an appreciation for the trauma that New York City went through during the height of the pandemic there and the success that they've had in the months following.
Yeah, you look at that image we showed, and we certainly have come a long way since 1918. It's incredible to think of just how serious this virus is and has been, considering the advances we have made in modern medicine. Let's talk about back to school, if you don't mind. This is a big issue. Several states already have kids back in the classroom. We are starting to see clusters of outbreaks. Joe Biden and Kamala Harris have pitched a nationwide mandate for masks. Do you think that we need to mandate masks in our schools?
I do think that schools, because they are indoor, because we know that there are going to be children there who tend to have very mild symptoms that may go unnoticed or maybe have no symptoms at all and can still spread this infection. So I do think part of making schools safe for the students as well as the teachers, is to have everybody wearing face coverings when you're in these settings. And I don't think it's that much to ask. I think it really is one way to allow schools to open in a safe manner. And we know that having schools open is a priority, that children need to be back in school, but we want to do it safely. And this is one way to do it.
Yeah, a little mask could go a long way to keep a lot of people safe. Dr. Adalja, thank you so much for coming back to be on with us. Hope to see you soon.
Thank you.
Across the country, doctors are still having a tough time fighting this virus. Emergency room workers in 3 different states, including twins treating patients in New York and Florida, told us about their biggest challenges.
The pandemic for me has been mentally and emotionally exhausting. Not knowing if you're going to bring it home to your family, to your loved ones. Because like for me, I take care of my grandmother and my grandfather on a daily basis. And, you know, you never know what you're going to bring home. And people, you know, aren't taking the mask wearing very seriously. And it's hard when they don't take it seriously, because you just want to know if you're protecting yourself and others, and, you know, specifically other people that have like autoimmune disorders or diabetes, or they battle obesity or anything like that. It's hard.
It is unfortunate that a lot of the other cities around the U.S., including down in Florida, are now being hit basically as bad as New York was. I was kind of hoping that as bad as it was in New York was going to be enough of like a forewarning for the rest of the other cities around the U.S. that we would be able to prevent the spread or prevent it from hitting such high numbers every day. But it seems like some other states and cities have actually surpassed New York's peak numbers of new cases.
Quite the different experience, even having heard all the stories secondhand, to be living what they were describing and to experience the same type of numbers and the same type of severity of patients. And that's what we're seeing.
We had a patient the other day that came in for a multitude of different reasons, and come to find out when we were testing this person for placement at a facility, they came up positive, and they had been in the ER for 8 hours. And it was hard because I had been in this person's face, I had really helped them, and even though I had my mask on, I didn't have the full protection, so the anxiety was even more heightened there. So it's always good to just take every precaution necessary, no matter what the patient comes in with, because the ER, like you said, we don't know what we're getting. I have seen everywhere from 20-year-olds that their oxygen saturations, you know, we like them to be above 92% normally if they're on room air. I've had 20-year-olds in the 80%. I've had 40-year-olds in the 70%. And they're on like maxed out oxygen. Some of them even go on ventilators. I actually was floated one day to the ICU, and it was a scary sight. And I actually had the most anxiety that day that I've ever had, because it was a tough sight to see. These people aren't breathing on their own. And it all could really be prevented if we just social distance and we just wore a mask and washed your hands and just follow the guidelines.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here. And click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.